I was going through my menopause, so when you do bleed, they see it as a concern. So I phoned the doctor, had an appointment. He then referred me to the gynae. It said that I may be asked to do a urine test, to take painkillers before the appointment, advise you not to have sex within 7 days of the procedure. And it also said about bringing somebody to take you home.
So you would be referred for an hysteroscopy if you had some symptoms of vaginal bleeding. So we see premenopausal ladies and we also see postmenopausal ladies. From your point of view, it is of course important to know that everything in the womb looks completely normal and there is no worries.
When I was at home, sort of 10 minutes before leaving, I took a Nurofen. I didn't know what to expect, so I just thought it might put me at ease a bit more. You can have the option of doing a general, so you'd go into theatre and have it done and they would completely put you out. Or you can have the option of coming in and doing local anaesthetic.
We really do advocate that you bring either a friend or family or someone who you feel comfortable with, and they're always welcome within our clinic.
You would come through level 1 on the Women's Centre, go to the reception, which is just through the double doors, show them the letter, and then what they done is they printed off a wristband. They put the wristband on me, they gave me a specimen bottle, and then told me to follow the green line. Sat in the waiting room and then a healthcare assistant will come through with a folder. She will check your name, address, date of birth, and then have a look at the number on the wristband.
We want to make sure that you're sure, you're happy. Obviously there's medications that, is very helpful for the doctor to know whether you're taking them or whether you've stopped taking them.
Then she will explain to fill out a health questionnaire and another form for emergency contact. She went off with a specimen while I filled out the form.
We do pregnancy tests for women who are up to their 55 years old. We want to exclude any risk of pregnancy.
Obviously, if you were to be pregnant, it would be dangerous for you and obviously the baby. So we wouldn't proceed.
The healthcare assistant will come and call your name and you come through and then you sit down and then they will go through the GP referral, what they will be doing throughout this procedure, and then they go through the consent form with you.
Consent's obviously a vitally important tool. We talk through the procedure and what it entails, go through the risks, and that gives you time to process that information. We then quickly recap and you tell me what you're expecting, and then if you're happy at the end of that process, we get you then to sign the form. But it's very important to say that if at any point you want to stop or you're not happy, you can then alert the team and then we can stop at any time.
The aim during the explanation of the procedure is to get fully informed decision if you would like to go ahead or if you think it may be best to reschedule your appointment, come another day, or have the procedure while you're asleep.
Once you've signed the consent form, then I will ask you to go behind the curtains, get yourself ready. You will meet one of my colleagues, which is we've got the RN and the CSW. So the role of the CSW, she will be next to you just to talk to you. We call it vocal local. So during the procedure, if you want, you can talk to them, holding your hand just to distract you from our procedure.
When you're getting undressed, the nurse will explain to you what you need to do, where you need to sit. When I was ready, I said that I was ready and they came round.
You're in control of this. You're our boss for the next 45 minutes. We do what you say. If it's not comfortable, we stop. We find that works really well with the women, that they've got that power to stop.
Even though you're in a vulnerable situation, you still feel that you've still got that. If you want to stop, you can stop.
And it's a two-way process. If you don't feel comfortable in how we positioned you, we can look at different ways of making that comfortable for you.
We offer a vaginoscopic approach, which negates the use for having a speculum. And we find that the majority of women actually don't need any local anaesthetic in itself. If that isn't the case and you are struggling, we can then put a local anaesthetic injection into the cervix. And it's a bit like going to the dentist. and having injection. That in itself can be a bit stingy and painful, and as I say, it requires a speculum examination, which can be uncomfortable for some of our women.
They're smiling, you know, they're not serious. So I think it makes you feel a bit at ease as well.
I'd like to hope that the actual procedure itself is going to be under 5 minutes for sure. Obviously the setup and getting you positioned and the consent, and that can take a bit of time. The actual procedure where you're feeling with the camera going in and we're taking photos and taking biopsies can anywhere between, you know, a couple of minutes to about 5 minutes.
We will talk and talk until you don't want to. Not everybody wants to, but I will always, every few minutes ask if you're okay. It's just a part of, I want to make sure, you know, even if it's a thumbs up, fine, I'm fine.
We start the procedure by using a very tiny, thin and long scope. And once we are in the cervix, that is the part where most women feel uncomfortable and may feel pain. We assess all the walls of the womb, and we also check if there are any polyps or any abnormal tissues inside. We use water to expand the cavity of the womb to better visualize what is inside. So it is a wet procedure. That's why we use an under buttock drape with a pouch so we can collect water.
When we use the water, that creates a bit of a pressure within the uterus as well, and that can be quite painful, so we have to be very mindful of that. But yes, the cervix will cause the crampy feeling that a woman gets, and it's described as a bad period pain.
If you feel lightheaded or you want to be sick, please do let us know, because in that case we don't want you to faint, so we would stop the procedure and we would make sure that you are fine before continuing. If at any point the procedure is becoming too uncomfortable for you, then we can stop immediately and rebook you for an hysteroscopy under general anesthetic at a later date.
You might feel like a tiny pinch when I'm taking some biopsy, because on the screen is showing that the amount of the biopsy is really big, the size, but actually when I take it out it's really, really tiny.
I have to use a needle to flick off the little biopsies and then put it into an orange pot, and we'll send that off to histology. We normally would try, because we need a good sort of outline of the uterus to make sure we get every part of it. So 5 or 6 little biopsies. Sometimes other clinicians may think that 3 are enough.
And if there are any polyps, then we aim to remove the same day. So we aim to remove the polyp at the time where we do hysteroscopy. So we diagnose and then we treat as well.
When I'm looking if there is any abnormality, if there is any polyp inside, but I'm more than happy to share the screen with you to explain to you exactly what I'm doing.
If you want to, you can ask me, Sam, move the screen over to me, I want to have a look. I can explain the thickening, if you've got a thickening in the endometrium. We can show you where the fallopian tube's come in. If you've got a polyp, we can show you the polyp. You can watch a polyp being taken out if you want. You know, it's really about what you want and what makes you comfortable with the procedure.
They let you know that they're going to put the bed down, and then they say when you're ready you can sit up. They offer pads and wipes as well. When you do stand up, you can get a flood of fluid out.
You're going to feel some water dripping in, because we've used about 500 mils of water. What goes in has got to come out, so I'm telling you, you need to pop a little something in between your legs, and that's going to get the excess water for you. We will then take the drape that collects all the water from underneath your bottom, take that away so you get more comfortable. We'll take your legs down from the couch. Make sure your head's feeling okay, you're not feeling sick in any way. We need to keep an eye on your blood pressure, basically. If you've been lying down for 10 minutes or so and you've been in pain, we need to make sure that you're physically okay to get up. Doing all those checks, if you tell me, yes, Sam, I'm absolutely fine, we get you slowly up. We slowly stand you up from the couch. Make sure you've got something in between your legs to catch that water. The CSW then will walk you over to your chair. Then you would be getting dressed. We offer a little hygiene tray where we give you wipes, tissues, and a little pad to pop in your knickers so you get any sort of seepage. You may have a little bit of a bleed, that's very, very normal.
And then you come out, you talk to the doctor again, so the doctor will then tell you the next stages of when you should be getting the results.
We need to wait for the biopsy to come back in order to 100% say that the specimen that we took is completely benign.
We then discuss obviously the findings of what we found and give you a rough idea of what we think might be going on. Sometimes though it is very hard to know or predict, the outcome of the histology. I know that these times can be very anxious for yourselves, but I'd like to hope that we'd give you some idea of what to expect. And there are times when, unfortunately, we are suspicious that there could be more sinister findings. Often it's once until it's been looked under the microscope, we just don't know.
We're going to send off your samples. You'll get your samples within 4 to 6 weeks. Any questions? Very important that we let you ask the questions, because obviously, if you're in a state of anxiety, you forget things. So this is your opportunity post-procedure to talk to us, talk to your doctor, find out what the next step is.
After the procedure, they do offer you refreshments, and they do suggest that you sit outside on the pink chairs for sort of 10 minutes just to make sure that you're okay.
Then I'll come over, I'll give you some discharge advice, just, some do's and don'ts. Make sure you feel okay. Find out how you're getting home, and if you're happy, and if there's somebody there and you're happy to leave, then you can leave.
If you've got any pain on that day, we will provide you paracetamol, Buscopan. Buscopan, it will help with the crampy pain. And regarding what you watch when you're going home, we will give you the discharge advice on what to look out. So normally we say that you might have bleeding for first 3 days. If bleeding is getting worse, we do recommend you to give us a ring on a gynae ward, which we will provide your number just to advise, or you can speak to your GP.
If at any point you feel unwell, you have fevers, you're sick, you have worsening pain and not feeling well, then it's important that you consult medical advice. If that's in working hours, then more than happy for you to contact the department, and one of the team will be able to then triage you appropriately. Likewise, if a GP feels more appropriate for you or convenient, then more than happy for you to go to your GP in the first instance.
When I got home, I was fine, and I think maybe after the painkiller had run off, I then felt sort of as if my stomach had been sort of scraped. It was quite a strange feeling because I'd never experienced that feeling before. Apart from that, I was okay.
Approximately 9 out of 10 patients that will walk through this door won't have cancer, and this is specifically in a postmenopausal bleeding setting. Having said that, the objective of this clinic is to then pick up those that do unfortunately have more sinister causes for their bleeding, but the chances of that happening for you are low.
I have heard from other friends about, oh, it's scary and that, and I say, no, it's not. I said, but then I also say that everybody's different. But I do think for your own safety and for your own peace of mind, it is better to get it done.